Good morning. This is Miss James. What I thought I would do to help you out is to go over which chapters are going to be on the test and just kind of help you out on how to direct your study. It does seem like a lot of chapters, but these chapters are short. And what I like about them is they're cut and dry, um, telling you exactly what's important, and then that way you understand how to apply what you've learned, because most of this test will be application. You're at the stage in the curriculum now where you should be able to apply what you've learned. You should be able to analyze the situation and determine what the correct action is. You will see, like I said yesterday, I'm trying to cover up my lunchbox there. You will see, as I was talking yesterday, a lot of prioritization. What would you do first? What's the most important? What I want you to learn from this class too is how to study for an exam, how to test, how to take a test, a nursing exam. You really need to read the STEM 3 times. Cover up the distractors with your Scantron until you really have a good clear idea of what the question is asking. Then uncover your distractors, read those 3 times. Because sometimes there's a word there that you may miss. I'm sure a lot of times you all can think about you chose an answer and you weren't thinking just because you thought it had all the information that you needed. Make sure you read the distractors 3 times before you select which one. Um, Try to give yourself at least 1 minute per question. I'm going to keep it to our standards with no more than 5. Select all that applies. They're all multiple choice. The only short answers are your 2 drug calculation problems that you will have. Okay, so if you'll pull out your calendar, pull out your book. What we had said was your exam would be over chapter 7, 8, 9, 10, 11, 13, 16, 17, 18, 19. And there's only going to be like parts of chapter 22 that your exam will be over. The only thing that I will tell you, because in your first weeks we had wanted you to kind of go over a few things in your book, just read over a little bit about what family-centered maternity care is, because one of the objectives for these first few weeks was to talk about the family and some of the birth options. We talked about some of them, using a birth plan, what family-centered maternity care is, involving the family, with the mom not putting people out and only isolating her. Some of you have been to Cabrini, you know what the family-centered care is. There's a little bit written about it in your book on starting on page 3. And it's talking about contemporary care and contemporary care of children. And we've talked a lot about culture. We're going to have cultural and culturally sensitive care every week that we're talking. So there are some aspects about culture in chapter 1 of some things just to read over so that you're aware. And there's some other culturally sensitive information in your other chapters that we'll talk about. Okay, so moving on. You should already know some things about menstruation and contraception, so we're not going to have a whole lot about that on your exam. With Chapter 7, Conception and Fetal Development, have a working knowledge of fetal development, but we're not going to be able to have time with 50 questions to get in depth. Just have a good working knowledge of what happens when, and the hormonal production. We had some good discussion over estrogen and progesterone yesterday, and you all seem to be very in tune with what that is. You are going to need to know what the functions of the placenta are, when it's developed, why it's developed, what it's there for, and all the functions of it. Review over the fetal circulatory system, just so you have a good idea. Okay, Chapter 8, Anatomy and Physiology of Pregnancy. What happens? What are the physiological changes of pregnancy? I know there was a voiceover PowerPoint that I gave you all. Listen to that. Read your book. Your book has a very clean, succinct explanation of all the physiological changes that happen in pregnancy. If you don't understand those, you won't be able to apply your knowledge, and you won't be able to determine what you need to do should something happen. What are the signs of pregnancy and the psychosocial aspects, psychosocial adaptations of the mom, as well as the cultural values? What do different cultures, how do they view pregnancy? What are their practices? Chapter 9, obtaining a client history, prenatal care. The prenatal assessment, we had some exercises over Nagel's rule, so you need to know that. How do we assess the uterine development, checking fundal height? We talked some about the pelvis, and we talked about them again yesterday, doing a pelvic assessment, and when it's important to continue history. I'm not going to ask you to memorize every time the individual is supposed to come back for an appointment, but just have a good understanding. Chapter 10 is all about the family, what the family decides, how she decides to deliver, how they decide as a family, the sites they choose to deliver, like we were talking about yesterday, if it's a birthing center, a midwife, if she wants to deliver at home, and the special considerations that are needed there. We aren't going to get a lot into cesarean section, but how those decisions are made and the reasons why. Okay, moving on to chapter 11, we talked a lot about nutrition. Nutrition is very important. How much weight should she gain? What's appropriate? What do they need to eat? Different cultures may eat different things, like we were discussing yesterday. So have a good idea of what good nutrition should be, especially for vegetarians and vegans. What's very important for them. We were also talking about adolescents. How do we get a good understanding of what their nutritional intake is? We may do some other testing and things, but what's the easiest way for us to get an initial idea of what their nutrition intake is? Religious influences, cultural influences. What are some psychosocial factors, and what if she has an eating disorder? So go over the nutrition chapter and make sure you understand what our nutritional requirements are during pregnancy. All right, chapter 13 is fetal surveillance. You know, we talked about the monitoring strips, how the fetus is monitored, how important ultrasound is, what it can show us. We're not going to get into a whole lot about quad screenings, fetal alpha protein. Those are important. Those are time limited when they should be done. Just have yourself an understanding of the different testings and screenings, especially testing and screenings for STIs, for syphilis, for HIV, when it's important for those to be done. When is it important for mom's blood type to be looked at? Because if mom is RH negative and baby is RH positive, there could be some mixing of mom's and baby's blood, and it could be a sensitization for future pregnancies, and she may need some Rogam, and she needs a dose of it about 28 weeks pregnancy. She also may need a dose of Rogam after an amniocentesis, and again within 72 hours of the birth. However, only if MN, mom negative, BP, baby positive. All right. Non-stress test is the other one that you need to have a good idea about what the procedure is, why it's done, what a reactive and a non-reactive test is. Why we use a stimulator, the vibroacoustic stimulator that I was telling you about, to wake the baby up. Biophysical profile, why we do that to determine the fetal well-being, the different aspects that we can test. A normal test is either an 8 of 8 or a 10 of 10. Each component of the biophysical profile is worth 2 points. 10 if the non-stress test is added. 8 if we don't add the non-stress test. So read about the biophysical profile in your book and the reason that we do it. Amniocentesis, mainly why the management of mom when amniocentesis is done. What's important? Reasons why we do amniocentesis and the monitoring after it's over with. Some of the problems that could occur. Main thing is monitoring that fetus once the amniocentesis is completed. Look in your skills book. There may be some things in there that's talking about what the nurse does during an amniocentesis. So moving on to chapter 16, we got into this yesterday, the processes and stages of labor and birth, preparation for it, any kind of childbirth education that may be taken. What are the critical factors of labor? And that's the 5 P's that we talked about. They talk about them a little different in the book. They talk about the passage, the fetus, the pelvis, and the physiologic forces of labor. And we talked about them yesterday as the 5 P's because I feel like that's a little bit easier for you to understand. But you will need to have a good knowledge of the critical factors of labor and the physiology of labor. What happens and why? Why does the myometrium stretch? Why does the pelvis muscles have to stretch? What goes on? What causes it? What decreases it? Progesterone causes the relaxation. So whenever it's time for her to start having contractions, the progesterone release decreases. So read about the physiology, the stages of labor, and what physiological systematic changes go on with mother. What happens to the cardiac output? What happens to the respiratory rate? What do we expect to happen with the blood pressure? And this is with a normal individual who we're not talking about someone with any type of chronic disease right now. What are we expecting to happen? All that's in chapter 16, and it finishes up with what should happen with the fetus during this time. What does the fetus experience, and how do we know what's going on with the fetus? What are we looking at? What are we looking at on the monitor? Chapter 17 deals with assessment of the mom, both physically and psychosocially. How do we assess the cervix? What are we looking for in a cervical assessment? We're looking for dilation and effacement to determine what stage of labor she's in. And we're also looking for what station the baby's head is in. Fetal assessment, there again, the presentation, what the heart rate is, how are we monitoring the baby, why do we use scalp stimulation? And we all talked about it yesterday. A cord blood analysis is done after the birth. Moving on to chapter 18, we're talking about the family a little bit and how we can support the family, how we can support the significant other. It's very important not to forget about them and to include them and make sure we know how they're feeling, because sometimes that has a direct effect on mom. And your book goes through the different stages and how to care for the patient as well as the family during each stage of labor, and how to promote comfort as well as supporting any cultural beliefs, being culturally sensitive to our clients. And I like the way your book lines it out. It's very clear, and it ends with evaluating our care on what we did throughout the labor and delivery process. Chapter 19 talks about pain. We talked about pain yesterday. I gave you some handouts about epidural and pain management. We also talked about using other forms of pain management besides regional. Um, have a good understanding of epidural, what it does, what physiological changes can happen to mom, and what our nursing management of those changes would be. Um, have a good understanding of the opioid analgesics that are used and why we want to be very cautious about using those. Know what Narcan is and why we need to make sure it's available. What do we do for management of if she happens to have low blood pressure from an epidural? What are some things that we would need to do to help alleviate that? And this is someone who normal heart function and her blood pressure is dropping. What is that telling us whenever we've got a low blood pressure? And what are some things we can do? Say, for instance, she's got a crystalloid IV fluid going. We can increase her fluids to help her volume come up, to help her blood pressure come up. We can reposition her. We can place her on, if she's lying supine, we could try left side first. We can put oxygen on because we may feel like she's not oxygenating well. What happens if the blood pressure goes down physiologically, so that we know measures that we can take as a nurse to help stimulate that blood pressure come up before we ever even pick up the phone or call, or we call someone to help so that we can manage our patient. We never ever leave our patient alone to go call a physician. That's why it's important now. A lot of us have our hospital phones in our pocket, or we use the phone that's in the client's room. And we have to look at the situation to determine what's worse, what's going to give us the most immediate response. It may be that I'm going to have to increase her fluids and give oxygen almost simultaneously. Which one of those is the most important? If it's a blood pressure issue, which one is going to help that blood pressure get up the easiest? Yeah, I'm going to give her O2, but her blood pressure is down. So the quickest way to get her blood pressure up first, turn up fluids, put on oxygen, turn her on her side. If it's the opposite, if it's oxygenation, I'm seeing fetal decels. What is going to get the oxygen to her the quickest? O2. Turn her on her side. Then I might think about doing something with fluids after that. You have to look at your situation and assess what is going to give me the most help, be the most safe first. And in reality, you know, everything is going on all at one time, but for your thought processes and getting yourself to critically think what is going to give me my best response first. Okay. Read about general anesthesia. Understand that is usually only done, well, that is only done in an emergency situation. Because if it's a scheduled cesarean section, we don't want her going into labor, so we have her surgery scheduled. Emergency cesareans, sometimes they have eaten, and you do need to know what the medications are that we would give to someone who's got to undergo general anesthesia. That would be very important. So I would tell you, make sure to read through the medication management, epidurals, and general anesthesia. Chapter 22, we're not going to go very far in there. I'm just going to tell you, we're not going to talk about version, because that is something that for a generalist right now is not important for you. Do read about caring for the woman during an amniotomy and what an artificial rupture of membrane procedure is. We talked about that a little bit last week. We're not going to do amnio infusions or cervical ripening for now. And we're not going to talk about inductions right now. That'll be next time. Episiotomy, please do read over that, because you need to have a good understanding of which directions episiotomies may be incised and how to care for them. We aren't going to talk about forceps or vacuum assisted deliveries right now. And we're not going to get into the all the whys and wherefores and information about cesarean deliveries. We will do that after we're done with this first exam. We're not going to do trial labors, nor are we going to talk about VBACs this time. So the only thing out of chapter 22 is the amniotomy and episiotomy. That's it. Now, if you go over your read your chapters. It's very imperative that you do that. There are some very good questions that I posted for you that are based on each one of these chapters. If you go over them and you're able to answer those, you should do fine on the exam. But if you do not read, there's no amount of lecture I can give you that's going to help, because you're going to need to know how to apply the information that you've read. These chapters are short. They're very good digests. If you want to read over ATI, not until after you have read your textbook. Do not study NCLEX questions for content. You can study NCLEX questions for practice in taking questions, which is very good for you to practice NCLEX style questions. But do not study NCLEX questions for a content exam. If you have any questions about anything, please feel free to email me. But my advice to you, and very strong advice, because I have gone over with you now chapter by chapter what you need to be familiar with. And that doesn't mean that's all that you're going to see on the exam. That is the background information that you need to read so that you're able to be successful on the exam. We're in application and analysis mode now. We're learning how to do our jobs for the safety and the quality care of our clients. And if I can help you all to understand how to study and how to prepare and how to take a nursing exam, then I feel like I've done my job. There are some very good critical thinking exercises and chapter focuses at the end of each chapter. Just because you had a baby, don't feel like that you're going to know this kind of stuff, because this is background information. This is the way things work physiologically, psychosocially, and culturally in the area of labor and delivery nurses, and how we can best manage our clients whenever they're coming into the hospital in labor. Okay, that's it. I hope it helps you, and let me know if you have any further questions. Have a great day.